Hi, everyone. My name is Jen Alfredson, and I work in the CCS program for the CARS department at Milwaukee County BHD. And I'm here today to do a training on Medicaid. This is supposed to be a very brief training, and I'm going to keep it to right around 6 minutes. The training is about Medicaid, and it's intended for CCS staff to learn some basics about Medicaid and how it affects the CCS program. So let's get started. I'm going to share my screen and go through a PowerPoint. Medicaid is also known as T19 or medical assistance. Medicaid provides healthcare coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by states according to federal requirements, and the program is funded jointly by states and the federal government. CCS program is funded by Medicaid. It's very important to understand what Medicaid is in order to verify that every consumer in the CCS program does have the proper Medicaid prior to them entering the program, and we check it on a regular basis. It's also important to understand the billing rules that are required by Medicaid, rounding guidelines, which services are billable to Medicaid and which are not, travel billing, and every case note needs to include a place of service, a date of service, start time of service, and the duration of the service in units, utilizing your proper rounding guidelines. So in order to know that a consumer has Medicaid that makes them eligible for CCS, it is very important to understand that there are multiple types of Medicaid. And in order for a consumer to be eligible for CCS, they need to have full coverage Medicaid. So here are some examples of full coverage Medicaid. Yes to CCS, Medicaid, Medicaid for SSI, Medicaid waiver, Badger Care Plus standard plan, Medicaid purchase plan. I also want to clarify that any full coverage plan can have an additional clarification of either HIPSA recipient or no copay. So it might look like the example you see on your screen where it says Medicaid for SSI, and then in parentheses it says HIPSA recipient, or in parentheses no copay, or both. It's still a full coverage plan. You're good to go for CCS. Now, these are partial coverage Medicaid plans, and the answer is no to CCS. These plans do not cover the CCS program. Specified low-income Medicare beneficiary, qualified Medicare beneficiary, family planning only services, and spend down. I also want to clarify here that if a consumer has a full coverage plan, they're eligible for CCS. If the consumer has another plan that's on the list for partial coverage, that does not apply and it does not negate the full coverage CCS plan. So an example might look like this: Badger Care Plus standard plan, qualified Medicare beneficiary. Those two plans might be right in a row when you run your inquiry. In this example, the person above is eligible for CCS because they have the Badger Care Plus standard plan. That is full coverage. The QMB plan does not apply to the CCS program and does not, but it doesn't negate the full coverage that the consumer has. So just real quickly, I just want to say something about Medicare because people oftentimes confuse Medicaid and Medicare. Medicare is different. Medicare does not fund CCS at all, so we do not care about Medicare. Medicaid and Medicare are different forms of government health insurance. So don't get caught in the trap of thinking that the consumer is all good to go for CCS if you see Medicare. Now, when you're running an inquiry for Medicaid, the inquiry can be run for a period of 1 year. You could run it from today's date last year to today's date this year to discover if there's been any lapse in service over the past year. But when a new consumer is coming in to the CCS program, we want to make sure they have current Medicaid and that they're going to have it moving forward. So you want to run that inquiry from today's date through today's date of next year. If that inquiry does show Medicaid for a full year, That would indicate that they're on a full coverage Medicaid benefit that automatically renews. But if that Medicaid shows an end date sometimes this year, this means that the renewal needs to occur ahead of time. And this discovery should be made clear to the consumer's care coordinator to make sure that that care coordinator can follow up in 30 to 60 days prior to the expiration. I am just going to say right here that if it's a brand new consumer coming in and the Medicaid is going to expire by the end of this month, it's something that you should follow up on before you continue with the intake. Now, there are Medicaid HMOs, and CCS consumers might be enrolled in a Medicaid HMO. But the HMO does not fund CCS, so it does not matter which HMO the consumer is enrolled in. The HMO does fund other services, though, that the consumer might utilize through Medicaid. So it is important to meet and have communication with the HMO care manager. There are Medicaid rounding guidelines that everyone needs to get familiar with. You're going to find these rounding guidelines in our FAQ, frequently asked questions. This is a document that is found in the SharePoint. The rounding guidelines are number 27 in the SharePoint in the FAQ document. Which services are billed to Medicaid and which are not? These rules will also be found in the FAQ document in SharePoint. Number 13. And billing travel to Medicaid. These rules can also be found in the FAQ in SharePoint number 25 on the FAQ. So in summary, the most important thing to understand is that CCS services are billable to Medicaid, as Medicaid is the consumer's health insurance. If the consumer does not show up for a visit, you cannot bill their health insurance. The travel code can only be billed when a CCS service occurred. If you're traveling to a service, you can bill Medicaid for your travel time. But if that service doesn't happen, you cannot bill Medicaid for the service because it didn't happen, and you cannot bill Medicaid for the travel because you didn't travel to a service that happened. So don't bill travel if the service or visit did not happen. Thank you.